Thank you, Chair Erdogan and the committee, for the opportunity to appear today. My name is Dan Knipe. I'm the CEO at the Amy Gillett Foundation, and I'm presenting today with my colleague, Dr. Marilyn Johnson, who is one of Australia's leading cycling safety researchers. She is our Research and Policy Manager and a Senior Researcher at the Institute of Transport Studies at Monash University, where she co-leads the Active Transport and Micro Mobility Group. The Amy Gillett Foundation, or AGF, is Australia's leading cycling safety charity. Our mission is for safe cycling in Australia. Our vision is for zero cyclist deaths and a reduction in cyclist serious injury crashes. So we champion an evidence-based approach to safe cycling. We support research, we create education programs and advocate for safe cycling. AGF was born out of the tragic death of Amy Gillett in 2005. She was training overseas as a member of the Australian women's cycling team. A young driver who was out of control of her car crashed into Amy and her 5 teammates. Amy was killed. Her teammates suffered horrific injuries and still have an impact 15 years later. This is an example of preventable trauma on the roads that happens regularly to people when they're riding bikes in Australia. Every day, 20 cyclists are hospitalised in Australia with a serious injury, like a fracture or a brain injury. A cyclist is killed every 10 days. These deaths are preventable. But these crashes don't just impact cyclists, they impact heavily on drivers. Most crashes where a cyclist is killed or seriously injured involves a motor vehicle. That means for most cyclist trauma crashes, there is a driver involved who lives with the emotional and mental health impact that can last for decades. We're currently experiencing very unique transport challenges and opportunities due to COVID-19. According to the current Victorian cycling safety strategy, which was published in December 2017, almost 2/3 of Victorians were interested in cycling, curious about cycling, but did not ride because of concerns about safety. Before COVID-19, approximately 640,000 Victorians regularly cycled. But during COVID-19, we have seen the number of people cycling skyrocket. Many people who were too concerned before about their safety are now riding during lockdown, and AGF estimates that there's over 1 million Victorians cycling regularly. What we're seeing around the world is many countries having similar cycling boom and taking this once-in-a-generation opportunity to rethink how we live, particularly in local communities and on local streets, by trialling separated bike lanes, wider footpaths and lower speed limits. The City of Melbourne has shown valuable leadership implementing temporary bike lanes, but this is just the start and it's only scratching the surface. We have the opportunity to do more now, particularly to make our local streets safe. In May of this year, the Amy Gillett Foundation commissioned YouGov to conduct a national survey to understand Australia's public attitude towards transport during COVID-19. The key findings were 89%, nearly 9 out of 10 Australians support investment in temporary separated bike lanes. 9 out of 10 Australians usually can't agree on anything. 75% of Australian drivers would be more comfortable if cyclists had their own separated bike lane. Support from drivers was highest in rural and regional areas. So since we made our original submission to this inquiry at the start of the year, the world has changed and we welcome the opportunity to present today. Our submission and presentation to this inquiry is focused on 5 key safety areas. The first one is a meter matters, minimum passing distance road rules in Victoria. Second one is 30 km/h default urban speed limits. Item 3 is separated cycling infrastructure. Item 4 is education for truck drivers. Item 5 is education for novice drivers. AGF's work in these areas is diverse and includes over a decade of research and advocacy work on Australia's minimum passing distance laws around the country. We have developed and currently deliver Sharing Roads Safely, a vulnerable road user awareness training for heavy vehicle operators, particularly truck drivers, and novice drivers. In Australia, we do not teach new drivers how to safely interact with cyclists. AGF was a partner in Cycle Aware, a major study funded by the Australian Research Council that developed content to address that gap. We note that Dr. Johnson presented to this committee in 2016 the committee's recommendation to amend Victoria's road rules to specify a measurement of safe cyclist passing distance relative to road speeds was not adopted by the Victorian government. Instead, an education campaign was conducted. At the time, in 2016, a metre matter rules were already legislated in Queensland and South Australia. Since 2016, minimum passing distance has become law in New South Wales, ACT, Tasmania, Northern Territory and WA. There's broad community support in Victoria to amendment to this road rules, including from RACV. Victoria remains the only state that does not have minimum passing distance road rules. My colleague, Dr. Marilyn Johnson, will welcome the opportunity to answer any questions the committee has. I will now pass back to the chair. Thank you.
Thank you, Mr. Knipe. And I'm sure my committee members are quite enthusiastic about asking Dr. Johnson a few questions. I just have, I've got a few of my own, but I might start off with Mr. Jepp, so he can go first. Mr. Jepp.
Thanks, Chair. Thanks, Mr. Knipe and Dr. Johnson. And firstly, can I begin by congratulating the foundation. You've done some magnificent work over a long period of time now, born out of a very tragic set of events that, and we all know this, the circumstances around that. So, congratulations to the foundation for the work and the advocacy that you do, and long may it continue. We have heard from all manner of different groups throughout this inquiry. You know, we've heard from cyclists, we've heard from walkers, we've heard from motorcyclists, we've heard from motorists, and my concern with all of these things is that because there are just so many different competing perspectives, that it's hard to land on a spot that will do the most good, you know, that will have the biggest impact across all of the road user groups. That is so necessary. So, Dr. Johnson, is it the foundation's proposition that out of the 5 approaches that Mr. Knipe outlined, is it that the metre matter rules, is that the key? I know, without discounting the other 4 things, but is that the thing that you believe will bring the biggest impact to a better road user situation in Victoria?
Thank you so much for the question. I've got some really bad feedback. Hopefully that's not coming through at your end. The simple answer is yes. It is the most important action, simply because we know that although separated infrastructure is incredibly important, and so are reduced speed zones in residential areas particularly. One of the reasons why it was 2009, the Amy Gillett Foundation even started the campaign around minimum passing distance, is because that creates a safe space for every cyclist on every road. So it really doesn't matter if there's a piece of infrastructure going in on one area in a city, if it's not happening in another, that protection's not being provided. What minimum passing distance does is it just simply changes the road rule. It's an amendment to the road rule to include a policy position that was already there. So it was already in the guidelines to say, and in the driver handbook to say, give the cyclist at least a metre. So it's just providing that safe space around every cyclist on every road. That's why it's the most important action. But you're right, it doesn't diminish the value of all of the other 4 key actions that we think are also important.
Thank you. Dr. Johnson, you may have your own speaker maybe a little bit loud. Maybe that's why we're getting a bit of feedback. I might pass over to Mr. Medic to ask a question, if he has one.
Yeah, thank you, Chair, and thank you both. And may I echo Mr. Jepp's congratulations on the work of the foundation, and it's been extraordinary. Look, I want to focus on just a couple of different areas. The first of which is I want to immediately offer my complete understanding and support of the 1 metre and indeed the 1.5 metre rule as well. Like Mr. Jepp and like Ms. MacArthur, who will talk in a minute or two, who has a special connection with this. regional roads present a particular problem where cyclists and interaction with vehicles is concerned, and that there is often, unfortunately, a lot of animosity directed towards cyclists out on regional roads, particularly when they're travelling in larger groups, and patience is a virtue which often flies out the window there, unfortunately. And I would think that there needs to be a significant, should we be able to introduce and pass legislation around those meterage rules, and I sincerely hope that we do, I think there needs to be a very significant education program on both sides as to what that means and the reasons why, so that people then can perhaps get rid of some of that animosity and understand it. But I really then want to focus on the reduction in speed limit in residential and urban areas down to 30 kilometres. It seems that there would be perhaps a certain amount of resistance from, certain circles to go from 50, a 20 kilometre reduction down to 30. And I bear in mind that, our speed limits around school zones, for instance, are 40, admittedly for a very short period of time. But we've heard from a number of witnesses across this inquiry talk about, well, let's even that out. Let's make all 50 kilometre zones 40 kilometres. I understand your reasons for wanting a 20 kilometre an hour reduction. It is a 40 kilometre hour reduction, so that's, that means then there's no having to introduce school zones at particular times of day. So there's a complete understanding from all road users that no matter what the time of day, this is the speed limit in urban and residential areas at 40 kilometres. Is that an acceptable outcome for you?
The reason for the 30 is it's just based on the science. So just purely from a physics perspective, once you hit someone at over 30 kilometres an hour, they have a much higher likelihood that they'll be seriously injured. And for those people who are at the ends physically of sort of the more vulnerable ends of the spectrum, particularly much younger people and older people, then those crashes at low speeds can be fatal. So certainly in residential areas where, as we've seen through COVID, I mean, this is where people are allowed to walk, and riding is another approved activity outside. So in an hour outside every day, we're kind of only in our local streets. That's where we all are. And it's a matter of bringing down those speeds from 50. So while ideally it's 30 kilometres an hour, because then obviously it doesn't lead to a serious impact of death, any reduction would certainly be welcome.
Great. And I have one other question, Chair, and it comes to where you're talking about the gap in education in undergraduate engineering degrees around road design, that it doesn't take cycling into account in that respect. And you quote the designing for pedestrians and cyclists run by Transport and Main Roads in Queensland, that could be adopted nationally as a model. Are you able to forward that to the committee so that we can actually read that and take that into account? I think that would be a very helpful document.
Yep, absolutely, I can do that.
Thank you very much.
Thank you. Mr. Barden.
Thank you, Chair. Congratulations on the work you do. You do marvellous work. It's and I agree with my colleagues. It's very important. The 1 metre rule and the 1.5 metre rule. Have you got data to support the changes which has been made into law in the other states compared to what's happening in Victoria? And are you able to speak on that? How we're performing, for instance, or how badly we're performing, or?
There's certainly data available on the effectiveness of minimum passing distances in other states and those changes that have happened. And most of that research has been done by the Centre for Automotive Road Safety Research in, I think I've got that acronym wrong, apologies to everyone who's at CARS-Q at Queensland University of Technology, but they've done most of the evaluative research. We've also conducted research here in Melbourne, where we've done trials and actually measured the passing distance of cyclists who've been riding along roads all across Melbourne. And what we've done is we've measured that distance between the cyclist and all motor vehicles that pass them on the right. So we've developed a device that uses an ultrasonic sensor to measure that lateral clearance distance to the right. And what we found is that and it was a metropolitan Melbourne study, so apologies, there's not data that we've collected through that study in regional areas. But what we found was that the places where cyclists were being passed most closely were those locations that they were in a bike lane, travelling next to a parked car on their left. So it's really those locations that's the tightest squeeze for cyclists, that drivers aren't allowing enough space on the right. And it's probably partly due to the road design. And that's where this conversation is much bigger than just the behaviour between the cyclist and the driver. But what we're seeing in the way that roads are being designed is that quite often what happens is that painted lines are put next to parking bays, and then it's just expected that the person riding the bike and the person driving the car will be able to work out when really there's just not enough space on the road for both. So what the minimum passing distance change does is it creates that awareness that cyclists need space, because really the question that it raises when we don't allow cyclists enough space is how much space is enough. And some of those speed zones can be 70 kilometres an hour, and 20, 30 centimetres between your car and a cyclist at 70 kilometres an hour really isn't a safe distance.
Thank you. Thank you, Chair.
Thank you. I had a couple questions myself, a bit trickier. First of all, again, doing fantastic work in your advocacy for the sector. But I did notice with some of the, obviously being a member of this committee and getting different perspectives from the road user in terms of vehicle, motorcyclist, pedestrian angle, there's been a number of presentations. And today I noticed that Victoria Walks made a point about the need for separation between cyclists and pedestrians, and the cyclists pose a hazard for pedestrians, especially elderly. I did have a question, because I know that you're doing a lot of programs on education for like truck drivers, for vulnerable road users. Is there more education needed for cyclists? And also, as someone that walks quite regularly, also around enforcement of the road rules for cyclists, because for motor vehicles, when they're doing the wrong thing, you can usually get the registration and report them. At the moment, conversely, when a cyclist does the wrong thing, it's very hard for drivers to identify the cyclist. And I know it's something that frustrates many in the commercial passenger vehicle industry, for example, of cyclists not necessarily complying. Is there something that needs to be done from a policy perspective on that angle? So,
yeah, I think it's a really common argument that's raised about the role of cyclists and them not being compliant. But I think what's often missing from that discussion is that not every driver is doing the right thing on the road. And whether that's creeping over the speed limit or going through the end of an amber light phase, whether it's not giving enough time before people are indicating, I think there are people on the road who think that they can nudge the rules and that's okay. And I think that those people, it doesn't really matter what mode they're in, whether they're driving or they're cycling, they're on a motorbike. I think it happens across all modes. I just think there are some people who think it's okay to do that. So is there a role for education for cyclists as well? Absolutely, definitely. But is it just cyclists who that needs to be focused on? No, it's everyone who thinks it's okay. And I think that's where it falls down, is when we have an expectation of someone else's behaviour on the road because we know the rules, and they act in a way that's deviant to that. And that's the issue, regardless of whether they're car drivers or cyclists. And to that point, one of the biggest issues for cyclists on the road is drivers on mobile phones. So that's probably one of the biggest risks to cyclists, is someone who's not paying attention even for that split second, if that means that they are not giving enough indication before they turn, or equally if someone's distracted in their car and they open their car door. So I think it's much broader than just one group. I think it's people generally across the population, which doesn't answer your question really directly, but it also raises just how difficult this is.
And can I just add to that, Mr. Erdogan, when you're talking about pedestrians and cyclists, coming back to Mr. Medic's question as well about patience, a lot of those frustrations, a lot of that anger that's being directed between the two groups, usually there's an infrastructure problem. It's not cyclists and drivers that are angry at each other. It's something has happened where the road has been very poorly designed and the cyclist is forced into a small space, and it makes the driver very nervous. It makes the cyclist worried about their position. And you do see similar things as well, where cyclists and pedestrians are put together in a way that's not helpful for either group. So completely understand that there's situations, but usually it's infrastructure that needs to be fixed. And I also wanted...
Sorry.
Oh, just touching on what one study that Dr. Johnson had looked at, actually, that looked at cyclist behaviour, and 93% of them were following the law. Were looking at it was a red light one, but it's very visible. When you see a cyclist going through a red light, there's a lot of people sitting there watching, and it looks like, and it's frustrating to see. So that 7% of cyclists in that situation, yeah, absolutely need education on it. But like Dr. Johnson says, that's the same in every traffic group, and 93% are following the law. It seems a lot more, and part of that frustration, I think, can come across in that area.
Oh, no. Thank you very much for that those comprehensive answers. And obviously, we all understand that the risks of a vehicle hitting a cyclist is a lot higher in terms of the human impact than the other way around, conversely. So I understand that. But I appreciate those. I just thought I'd ask a different question from what you usually expect. But from me, that's all, actually. Did committee members have any other questions? If not, Mr. Jeff?
Look, I just want to just a comment, Chair, and I think just that last question and response, I think, sums it up for me. I mean, I think it's the difficulty with this sort of inquiry, of course, is that often what we do is we try and apportion blame. We try and look for the lowest common denominator in terms of poor behaviour. You know, and whether it's a cyclist or a walker or a motorcyclist or somebody behind a vehicle, you know, the wheel of a vehicle, truck or car, there are always going to be people who will disregard whatever the circumstances are. So, that's why I asked the question I asked around, you know, what's that if the meter matters, if that's the thing that's going to have a greatest impact, then, you know, I think for me, we've got to advance that. But that's my frustration, I guess, with this sort of inquiry, that we do often target the lowest common denominator. And I think if we could just say to everyone, just be patient, we'll get there.
Yeah.
You know, another 10 seconds won't matter. But if you rush, it could matter for the rest of your life. So. And
that, if I can just jump in, that's definitely something. So in the opening comments that Dan made around the Sharing Road Safely program that the Foundation runs, very, very strongly based on the safe system approach, but really, so this is training heavy vehicle drivers to be more aware of vulnerable road users. The underlying premise of the safe system principles, but also of the course that we've adopted with that, is that people make mistakes. And that's all it is. We have truck drivers who can come in and be very defensive, that we're going to point the finger and blame them. It's not what it's about. It's just giving them a greater awareness of what it is to be a vulnerable road user on the road around them when they're driving trucks. But it is the fact that the cyclist will make a mistake, or the pedestrian will, or the truck driver will, and those outcomes can be catastrophic. So very much it's about people making mistakes, but there's a responsibility to build a safe environment so when those mistakes occur, people aren't killed or seriously injured. So that's definitely the approach that we're coming from.
Indeed, more strength to you.
Well, thank you. The committee now needs to go to our lunch break, but before we do that, on behalf of the committee, I'd like to thank the Amy Gillett Foundation, and especially you, Mr. Kniep and Dr. Johnson, for your work and research. I enjoyed reading your submission, and I thank you again for presenting to this committee. I know it's the second time. It's great to see your passion and advocacy continues, so may it continue for long after this committee. On that note, we'll go to our lunch break for 1 hour, and I'll see all the committee members at that stage. Thank you.
Thank you so much. Thanks, everyone.
Thank you.
Bye.
Thank you.
Thank you both.